So, I mean, you've been out of medical school, I guess, for around 10-ish years, but you probably feel like with this venture, you're learning every day. It's probably like education almost every day. It's just the learning from a different aspect. Now you're having to learn how to navigate startup, how to navigate employees, how to manage a team, how to do things that's totally different from a different perspective, less from a healthcare team, if that makes sense.
Yeah, definitely. I mean, the neat thing is that I'm still learning a ton of medicine, and not just medicine, but other fields too, because we do everything from surgical tech to podiatry to dentistry. So we're always learning from all of the user feedback and everything that we get in all those different areas. But then, definitely, I mean, there's a component of technology knowledge you need to build, business knowledge that you need to sort of learn on your own if you don't have, like most of us don't have an MBA or something like that to fall back on for that. So it's sort of a continuous learning experience.
I guess the CME for most physicians is almost like the CME that you're doing, because you're constantly keeping up with every specialty. You're probably doing it. You probably know more than most specialists as it is, right?
Yeah, I mean, you learn tidbits here and there of a little bit of everything, and that's fun. And I love learning, seeing something new or learning something new, especially when they come out with new guidelines for things that we have to go back and go through all our content, new blood pressure guidelines or whatever they may be. You have to go back through, and you're learning so much as you're digging through to make sure that we've updated that everywhere. You're just pulling out all kinds of information and new updates that you probably wouldn't have caught as quickly if you were in practice in a different area, I guess.
Yeah. So I have to tell our listeners that I had our producer reach out to you specifically for the reason that I've used your guys' product. I didn't even pay for it. It was one of the trial periods when I was testing out different stuff. And that's only because I haven't taken step 2 yet. I've taken step 1, but step 2 I'll probably be taking in about 2 years, because I'm between 2 different programs. So I was like, I need to periodically do some type of practice materials or practice questions to keep up on my clinical knowledge. And I used your guys' stuff, and I did a little research on your background, and I was like, you'd be such a cool guest to hear how you made that transition, but also where you think the board, or where you see the board certification process going, because I know there's been a lot of debate in it. How has it been, I guess, trying to navigate constant updates from all the different specialties?
So it really varies by area. So some boards are really good about letting all of their diplomates know about whatever changes are coming through. Others just change it and they don't tell anyone. And so sometimes we'll hear from the boards or from various publications, and other times we don't know about it till after the first round of test takers have gone through, and they tell us, like this or that changed, or I saw this on my exam I never knew would be there, and then we'll reach out to the board and they'll say, we added in a new category or whatever it may be. So then we're kind of working back to make sure that we can do that. So our only priority is to make sure that people can know what they need to know to pass. And I think so much time is spent studying and preparing for these tests. It takes away a lot from like a practicing physician's important job, which is to take care of people, patients. And so I think whatever we can do to save some of that time and make passing the test easier, that's really what we're here for. So
yeah, I mean, I think that's such great, because I think about everything that we've learned over the years and everything that I'm going to be learning, and it's just trying to keep it all in one spot, or trying to keep it coalesced to like a small area to where you know exactly where to go to study it, just never seems easy. And obviously for step 1 and step 2 it's a lot easier because there's very few materials out there. But I know for board certifications I've just heard horror stories about people not knowing where to go, or it's just like they're always asking colleagues or older residents. So I'm so happy that you guys are now at the service that allows people to stay up to date and know exactly where to go, and they don't have to worry about trying to keep handwritten notes or anything just kept up.
Yeah. And we do still use that process. We just get all those, all the information and handwritten notes and squish it together into a question bank. So it's the same, it's the same information that was out there that you could find or get at least pieces of, and we've just brought all the pieces from all over together and made sure it's in one place, so you don't have to read a whole textbook. It's just in one condensed kind of bank. So
So what, I guess at this point, what are you excited about, I guess, both for your company, but also where medicine's going, and transitioning, I guess, in the next few years?
Yeah, I mean, we're always keeping up with all the changes as far as, a lot of changes as far as recertification, CME requirements. So we do offer CME now as well. And so keeping up with all that has been a challenge for sure. And so we're just continuing to fill in wherever, there's demand for educational products or CME, new health fields, there are always new specialties coming out. And so that's, we've just been continuing to scale and grow to meet that demand. And we just found out this year, actually, we made the Inc. 500, so we're pretty excited about that.
Congratulations.
Yeah, so that was a pretty exciting thing for everyone this year.
That must be a big, that must be kind of a huge relief that you've worked so hard, or you've taken this venture and now to get outside recognition from I guess, business aspects of it, right? Instead of just getting recognition from the medical community, you're getting recognition on a business scale that you're one of the most disruptive healthcare and growing startups in New York, which is great.
Yeah, definitely. I think, especially within education technology, it's a competitive field, and it's not a field that a lot of investors want to take seriously or invest in, just because there's continuous changes, lots of competition. It's sort of a challenging area to be in. But yeah, we were excited to see that, and actually on the Inc. list this year, we were the 4th for education startups. So pretty neat.
Wow, that must be like a big change. So I have to ask you some of our traditional questions that we ask all of our guests.
Please do.
I'm going to tweak all of them though, because you're not practicing currently, which is going to be great. Like, having gone through medical school and now working in kind of more of a biotech startup area, what does medicine mean to you now, looking back from what maybe it meant when you were applying to medical school the very first time?
So, I mean, obviously I'm looking at medicine from a different vantage point than I thought I would be. And I sort of looked through, I've looked through both vantage points, I guess, if you will. I think I see clinical medicine, I see so much opportunity for physicians to really take more control and really guide it the way it needs to go. And so I really hope that happens. I hear from a lot of physicians, frustration over things like losing a lot of administrative control to non-physician administrators and such. And so, I hope, and I think the new generation of medical students and physicians will have that, have an easier time maybe than some of us to take that control and try and merge their knowledge with some administrative knowledge as well, so that they can be the administrators, so that all hospital administrators can be physicians. That would be fantastic to see. But so I guess from my viewpoint now, I just see medicine as just a continuously changing field, and I think the more medical students can have a broader based background and be prepared to jump in and fill in gaps or take on responsibilities that maybe weren't traditionally, clinically held positions. I think I'd like to see that happen more.
Well, that'll be great. I think that is going to happen. I think especially the younger generations are definitely more of that. They're more minded of, I want to do more, as opposed to like focus on one thing. They're definitely more a little broad based. From everything that I've experienced so far with my classmates and everything that we've talked about. So one of the things that I also like to ask all the guests is, now you've been on both sides. You've been a physician. You're still a patient, I'm sure, if you ever go to the doctor. What's it like being a patient, or what advice do you have to physicians or residents maybe that see you, or when you're being treated, just to remind physicians of how to remember how to treat patients, or how to be more of from the patient's perspective, like what a physician should really embody, if that makes sense? Yeah, no, I think definitely you should just remind yourself, but on both sides, remind yourself of what what the physician's going through when they're running late, or they're causing a delay in your time when you're a patient. To always think about what must be going on the backside, and often it's an emergency, or there's someone who's really sick and needs some time. And so I think it's great to remind yourself
as a patient, that that's some of that might be going on and causing, your frustration. And then the other way around too, I think physicians need to remember, and medical students need to remember that, each person sitting there waiting probably has a whole nother life, maybe kids to pick up or whatever. And so there's a balance, I think, of respecting each other's time and trying to understand more about each other. That'll help, keep that in check.
Yeah. Now, looking back, what advice would you give to maybe college kids who don't know if they want to go into medicine or business? Looking back, thinking about your whole route, I guess what advice would you give them if they're trying to make that decision?
It's such an individual decision, and it's something that I feel like is, almost forced upon people too early, and you're so committed when you get into medical school because there's, you've gone through all the tests and interviews and everything to get in, and then you've invested a lot in tuition, and so I think, best advice would be to try and get as much experience in the area first and make sure it's a good fit. Look at what other things interest you first before you commit to it, and then also just, it's okay if you change your mind. You can, there's so much flexibility within medicine as far as you can do anything from head to toe, as well as outside of clinical practice. So you can do administration, you can teach, you can really, the breadth of career fields still fall even within the medical school umbrella, if you will. So I think just keeping in mind that it's okay to change your mind and move around a little bit.
Yeah. And it's interesting because I ask a lot of physicians similar questions, and it's cool to hear the how they take what they've learned in medicine, whether it be in residency or medical school, which are very specific, skill sets that we learn, but oftentimes they're a lot more transferable to daily life than what people want to give it credit for or they think about. I mean, it's very transferable to almost anything we do. How do you use some of the things you learned in medical school, even if it was more of how to study with a group, how to work together with a team, and how do you use that now, working at a company that, doesn't necessarily treat patients? Definitely.
I think you learn certain skills from medical school that translate into just your life, and I'm sure most medical students can feel that when they go home to their family or friends and they see themselves like doing things like pausing and letting the person talk and maybe being a better listener. And so I think those things that don't come naturally to a lot of people, you learn that's something you have to make yourself do so you can actually elicit good information and have a good dialogue with someone. So that's one example, but I think so much of what you learn can translate into not only different job but in your personal life too.
I couldn't agree more. So before we wrap up, I obviously want to thank you for all of your time and your team who's allowed me to come down here in Manhattan and interview you. I think what you're doing for medicine, to me, is an area that more physicians need to consider, not just because I think physicians need to be running everything that is outside that's associated with medicine, but because, if they want to, go for it. But I think that it really is nice having physicians who understand what it's like from a medical student perspective, what it's like from a resident perspective, what it's like from that perspective, to then go out and say, how can we make that group have a better time? Obviously with BoardVitals, you're helping everyone across the gamut of healthcare professionals trying to ease their transition from doing their maintenance of certifications and again becoming board certified. Whereas hopefully this podcast and everything that we're doing with Surviving Medicine is helping students find balance, be able to maintain their motivation, and kind of give them the tools and tips that they need to transition and keep them happy. And I think what you're doing is obviously similar to what I'm doing, just on a different front. So I want to thank you for that, because I think it's something that more of us need to consider about doing, because so much we just want to help our patients, but we forget to help our colleagues. Which in medicine, that's sometimes the people that need the most help, especially if you think about the first 2 years of medical school.
For sure.
So I want to thank you. I want to thank you for that. And then, do you have any last tidbits or last bits of motivation for, I guess, our listeners that are struggling. Maybe they're going through their board certification process, or maybe they're going through step one studying, and they just need a little bit of motivation to get them through those late nights and early mornings stuck in the library.
No, I mean, I guess I always think about whenever there's like a struggle, I'm having like a difficult time with something, I always remember the quote, and I don't know who said it, but it's that, you know, tough times don't last, but tough people do. And so just wait, like it's not going to be forever. Just get through it, and, you know, you'll be better for it.